We're talking to probably one of the most important people in Leicester, believe it or not, or Leicestershire, or even actually you could say in the East Midlands now. We're going to be talking to the Chief Executive of Leicester Hospitals. That's the three sites, which is Leicester Royal Infirmary, the Glenfield and the General Hospital. And also he's in charge of the Northampton group of hospitals as well. So it's a huge organisation. So we're going to welcome to Richard Mitchell. Welcome this morning, Richard.
Good morning, Zuffar. Thank you for that very kind introduction. When you began, I was looking around the room to try and work out who you were describing. It's lovely to see.
We were joined in the studio with Hugo as well, who's so we've got two Mitchells for the price of one.
My
so
young son who's watching Netflix at the moment.
Okay, great. Richard, thank you very much for coming in. First of all, how many people are you in charge of across all these hospitals? Because there's quite a lot of people working at Leicester.
It is, yeah. Lovely to see you again, and may I wish everyone a blessed Ramadan. I've been the chief executive. Well, my family and I have lived in Leicester and Leicestershire now for 10 years. Been the chief executive of University Hospital Leicester, as you say. That's the Glenfield, the General, the Royal, and we also have services from our community hospitals. Fortunate through that there's the best part of 19,000 people in the organisation, and then since October 2023, so nearly 6 months now, I've also been fortunate to be the chief executive of the University Hospitals of Northamptonshire. That's Northampton General and Kettering General. That's a further 11,000 people. We've got very close clinical services across Northamptonshire and Leicestershire, so it's the best part of 30,000 people in total.
Wow, so 30,000 people. Am I right in assuming that actually the NHS is one of the largest employers in Europe, if not the largest employer in Europe, as an organisation?
I think it's third in the world behind the Indian Railway and Walmart. 1.4 million people.
1.4 million people. Yeah. Wow, huge organisation. And what made you be part of the NHS?
It was originally by chance. Both of my parents worked in the public sector. I wanted to do a job where I felt I could be part of a team that made a difference. After university, I happened to get a job working in Lewisham Hospital in South East London, which is where I was born. I was working and in an admin role. I was prepping notes. I was a receptionist, and I've taken it from there. As I say, we've lived in Leicester for 10 years. I think what I like about the NHS is I like the fact that I get to work with fantastic people every day. I like the fact that I'm part of a team that makes a difference. I like the scale that we work at. I like the responsibility. I absolutely, and we'll touch on it today, I'm sure, I recognise that we do not get everything right, and we can touch on that, but I do believe that people should feel proud of the University Hospitals of Leicester. I do believe that people should recognise that the services that we provide are safe, that there have been dramatic reductions in the volumes of patients waiting for care and for waiting times. We've got fantastic people and we've got more work to do. So I feel fortunate to work in the NHS. I don't think it is the easiest organisation in the country to work in, because it is large and it plays a massive role in everyone's life, but by and large I really enjoy that responsibility.
Thank you, Richard. And you know, you've come out on a Saturday morning. I know that when I've spoken to you in the past many times, you're out very early in the morning. You're actually very passionate about what you do as a job, and you don't look at the time. You just want to do the best possible job. What drives you so much to do so? You know, because you don't just do a 9-to-5 job, do you?
No, but in most respects, I think I'm very fortunate to do my job. I have high levels of accountability, and I've got fantastic people around me, whether that's the executive team, whether it's the colleagues across UHL that I work with. Exceptionally grateful for the support that you give us. We've got many voluntary and community organisations that we work with, whether it's Sharma Centre, whether it's Africa Caribbean Centre, the Centre Project, Somali Mosque, etc. I feel extremely well supported, given the size of University Hospitals of Leicester, given the relative seniority of my job, given my desire to make things better for the people of Leicester and for the people who work in our organisations. I am very happy working, I think, with a pretty high degree of work ethic.
Yeah, and it shows because, you know, Leicester is the heart of the country, and actually the hospital's the heart of this city, really. That's the way I look at it. Because, when we had COVID, there was so much happening at Leicester's hospital, so much support from so many people. I remember people walking with pizzas, people walking with food and drinks, and it was really, really pleasing to see so much community support for our NHS here locally.
Absolutely, yeah. So let's just talk a bit about Leicester City for a minute. And I know these are points that you and I have discussed previously, and we passionately are proud of the city of Leicester. So what are some of the facts about Leicester City? It is the first and possibly the only plural city in the UK. That means that there is no ethnic majority. We should celebrate and recognise and be proud of our diverse city. From a population perspective, I think I'm right in saying it's the fastest growing population city in the Midlands.
Yes, we have got a call coming in. So
okay, excellent. Can I continue?
Yeah. No, we'll just wait. Good morning. Assalamu alaikum.
Hello, good morning.
Good morning. Assalamu alaikum. Yes. So hi, Tony. You're right. I can recognise the voice. Have you got a question for Richard?
Yeah, I would. Hello, Richard. How are you? It's Tony.
Hi, Tony. Lovely to hear from you.
Yeah. Tony, Richard, just before you got appointed, we spoke to your chairman, John MacDonald, because when Karamjit Singh was the chair, I'm from a family carers group, as you're probably aware, that we're asking questions about how UHL engages with family carers effectively. And we were asking the board to set up a board member for strategic lead for family carers across the organisation, and also to have an effective engagement panel. And John MacDonald was very keen and said, when the new chief executive starts, I will certainly be back in touch with you, Tony. And we've never heard anything about family carers, all from John MacDonald. And I find that really disappointing to some extent.
Well, thank you for getting in contact. This was not something that I was aware of, so I'm sorry that John didn't get back to you and then it wasn't passed on to me. More positively, we have, both in our public boards and in wider environments across UHL, have had many conversations about family carers and the implementation of the carers passport. So whilst there have not been conversations directly with you, we have made progress. What I would ask, if it's okay, my email address is richard.mitchell@uhl-tr.nhs.uk. It's also, if you Google my name, it's easily accessible. If you want to contact me directly, Tony, you have my word that I'll get back to you today or tomorrow whenever you email me, and we can organise a time in the very near future with the correct people to look at this. The person who has got board responsibility for this is Julie Hogg, who is our fantastic chief nurse. We're making progress. It'd be good to share that with you and to get your thoughts on what more we can do.
Thank you, Tony. Thank you for your question. We've got to move on. So you were talking about Leicester and how you feel that the city is coming together.
So it's I think it's a fantastic city. We've spoken about the diversity of the population. Then it's in terms of the number of people who work here, it's the fastest growing city in the Midlands. It's also economically developing the most. I think it's got a huge amount going for it. I'm incredibly proud to be a small part of Leicester City. You were touching then on the impact that the NHS has. So we care for in excess of 2 million people. We employ, as we said, 19,000 people. I think we have a huge responsibility to do the right thing. I think we have a huge opportunity to make a difference in people's lives, and also think we have there's a significant chance that we could get things wrong given the scale that we work at. The team and I are motivated by trying to make a difference at scale, and I think by and large now, despite COVID and a range of challenges that were unique to UHL, we are now on the right track. If you look at maybe something you and I have spoken before is about the importance of culture in an organisation, the way that we treat people. I am acutely aware that I'm a white heterosexual man, and when I at work, I have a name badge that says Chief Executive. My experience of working in a hospital is atypical. I'm aware that protected characteristics and a range of other factors impact on people's employment opportunities and people's experience of working at university hospitals of Leicester. I passionately want all 19,000 people at UHL to receive, to have the experience of working in the organisation that I do. And if you look at our NHS staff survey, which is the most effective way of getting a feeling for people's experience of working in the NHS, there are 118 NHS organisations, and last year University Hospitals of Leicester was the 4th most improved. We've got our public board report, on Thursday, and in the report in there I've said very clearly next year we want to be in the top 5 for place to work in the NHS. The only way we can deliver that is by improving the experience of all of our colleagues, not just a few.
And what would you say your biggest asset is at Leicester's hospitals?
It's the people who work there.
The staff.
The staff. I would call them colleagues. We've got absolutely fantastic people, and I think one of the real privileges of being a chief exec of the hospital that my family use, that my friends use. I've got many friends from outside of work who work in the organisation, is the ability to get to know people, and I'm continuously amazed. I often talk about my bias. The fact that I think UHL is moving in the right direction, is that bias or is it pride? Actually, I think it's pride. I'm super proud of the organisation. We do not get everything right, and I'd be very happy for any of your listeners to ring in and speak about their experiences. I'm sorry for people who are waiting longer for their care than we would want. As we were saying yesterday on the Friday Focus, which is the virtual communication session, I'm sorry for how hard people are working at the moment, but undoubtedly the biggest asset for UHL and across the NHS is the world-class people who choose to work there. From the porter to the domestic to the healthcare support worker to the professor to the midwife to the allied health professional. You and I have touched on this before. Yeah. I think one of the beautiful things about the NHS is there is a job for everybody.
Yeah, there certainly is. We've got another message coming in. Salam Zuffar, my name is Amar Afzal. I was recently had heart surgery at Glenfield Hospital. I must say, from the outset, the staff and doctors were absolutely fantastic. Ward 31 and ICU. I and my family would like to thank them all for their hard work and dedication. After such a major operation, the care and encouragement I received was fantastic. And again, please pass my heartfelt thanks on to your staff, or to all your staff that work at the hospitals.
Thank you, Amar Afzal, for the message about your recent heart surgery and experience. I think it was Ward 31 and ICU over at the Glenfield. I will pass on the message to the team there. The team who work at the Glenfield, like the rest of UHL, is fantastic. And one of my neighbours, his brother, 3-4 weeks ago had a heart attack. And he was rushed to the Glenfield. He's had heart surgery like you, and I was chatting to him yesterday, and he's recovering really well, and his experience is very similar to yours. So I wish you well with your full recovery.
Thank you, Ahmad, for that message. I know I went to see him a few days ago, and he's doing really well. So, mashallah, alhamdulillah, I think hope he gets better really, really quickly. And he was just in awe and praise of the staff at the hospitals, because when it works well, it really does work well, and you really feel that you really are truly being looked after by angels, and that's what it is. You know, I have so many comments like that we receive, and not everybody gets the opportunity to say thank you, but please pass those thanks on towards 31 and ICU as well in particular.
I most definitely will do. And just a couple of points on that. So as I said, we don't always get things right, but I often think the outcomes that we provide are world class, but I recognise that the process to get to the outcome can sometimes take longer than we want. It all can sometimes feel not as joined up as it could be, and we're really working very hard to change that. What I would say is, when people have received a good experience, is if you feel able to take the opportunity to thank the people involved in your care, and if you have not received a positive experience, or you think there's room for improvement, in an appropriate way, please take the opportunity to raise your concerns. As I've said previously, I am, I believe, very accessible through a range of different ways. If people contact me, you will always get a personal response. If the person contacted me, and if I feel it's appropriate, we will always offer to meet them for a face-to-face conversation. Since you and I last caught up, Zuffar, one of the changes we've made is at the Royal Infirmary Hospital now, we have a drop-in service, a drop-in patient advisory liaison service, PAL service, where you can come in and you can ask some questions, and there's some clinical colleagues who are working there who have access to your information and will confirm when your appointment is or resolve things. So what we're trying to do is move away from the formality and the length of time it takes to respond to a complaint to having a far more accessible service. As Julie, our chief nurse, said to me yesterday, at the moment that service is inundated because we're such a large organisation and they are now so accessible. I think that will dampen down over the next couple of months, and if we can make it work really effectively, that will be a service that we will also be running at the general site and at the Glenfield, and it's my ambition that I would like UHL to also be on the high street in the city of Leicester, whether that's from employment perspective or just making ourselves more accessible. We want to have drop-in services that everyone can access.
You talked about employment services. You know, you've got 19,000 jobs out there. What would your message be to young people out there who have just started their A-levels, maybe thinking about a career? What kind of opportunities are there in the NHS, and is it accessible to people locally here as well?
Yeah, absolutely. So we're doing a huge amount of work at the moment to ensure that we are a local employer. For those people who want to go to university, we've got 3 brilliant universities on our doorstep, with De Montfort, with Leicester University, and with Loughborough. We're doing a lot of work around with them, particularly around some of the clinical jobs. So midwifery, from nursing, allied health professionals, doctors and others. For those who don't want to go to university or are not able to go to university, we're working, doing huge work with sixth form colleges and with schools. We do a lot of work with Leicester College about making sure that the local students are aware and are able to access the employment opportunities. We do lots of drop-in sessions for recruitment. I was in Belgrave, on the Belgrave Road a couple of months ago, and I think it's, from memory, I think it's Belgrave Library, where we do drop-in sessions there. So we really want to make ourselves accessible. What I would say is I joined the NHS back in 2002, 2003. And at that point, often a lot of us if you close your eyes and you think of the NHS, you can picture a doctor and a nurse and maybe some other colleagues. You don't recognise the immense number of people who need to do their job to support the doctors and nurses to do their job. So if you are interested in working in finance or human resources or organisational development, or you're interested in engineering, or you're interested in pharmacy, or you're interested in estates and facilities, or etc., if you've got administrative skills, the NHS, your local NHS, may well be the employer for you. If you go onto NHS Jobs, you'll see that we continue to recruit across a whole range of professions and disciplines. I think I'm right in saying in the last 3 years or so we've recruited 3,000 more people. I mean, that obviously brings cost pressures, and maybe we'll touch on the finances of the NHS, but your local hospitals wants to employ in the people of Leicester City and beyond. So please give us an opportunity. And I think it is, we've touched on it before, I think it is rare that in this day and age, the NHS quite often is a job for life. We would love to pay people more, but I do think the salaries we pay are fair, and it's also a really good pension scheme.
Excellent. And so there's jobs for everyone, lots of different angles, lots of different avenues they can follow. And it's really good because you probably employ 19,000 people locally here in Leicester, Leicestershire. So there is a huge sort of buy-in to your local community.
Absolutely. One of the things we did quite early on when I joined UHL is we took the information about the 19,000 people. Obviously, we worked within data protection laws, but we mapped it based around people's postcodes. And not only do you see that such a large proportion of the people who work at the Glenfield, the General and the Royal live locally, but also then you see the breadth, and you sometimes see the commute that some people have. So we have colleagues commuting in from from East Anglia. We have colleagues coming in from Yorkshire. We have colleagues coming in from the West Midlands. I think the fact that people, there's two aspects to that. So the fact that so many people live locally just reconfirms how important UHL is. But the fact that also is there's a fairly sizable group of people willing to commute a long way every day also shows that not only their commitment, but actually that UHL is a really good employer.
Yeah, and you can feel that when you go into the organisation now. You can actually feel that because doctors and nurses are really happy to be there. And it says in your survey, as you rightly pointed out earlier, you're listening to Radio Ramadan on 87.7 FM. Our telephone number is 0116 4822 or you can send us a WhatsApp message on 077 488 55055. I'm here this morning with the Chief Executive of Leicester Hospitals, Richard Mitchell. Good morning, Leicester. If you've not woken up, I know we're fasting and Ramadan with last few days, and it's very tiring now towards the end. And we just feel I was struggling to get up this morning, and I think the same as everybody else across Leicester, because we're coming down. Waking up at night, it's just breaking that pattern, and towards the end you just get a little bit more tired. It's not the hunger, but it's the tiredness that takes its toll. But mashallah, it's going really well for me, and I'm hoping it's going well for everybody out there as well. Richard, one of the things that you were mentioned as well was finances. There's not much money coming into the NHS at this moment in time. And how is the hospitals doing financially? Are you going to be selling off some land at the General Hospital? What is actually happening with the finances at UHL?
So we receive and we spend a huge amount of money. It may surprise people, but the University Hospitals of Leicester spends 1.5 billion pounds a year. Pardon me. That breaks down to in excess of £4 million a day, of which the vast majority of that, 70% of it, will go on paying our workforce. So we receive a lot of money, but we also need a lot of money to provide the services that we provide, whether it's emergency care or cancer or diagnostics or others. Healthcare is incredibly expensive. I'm not political, so I'm not making political points here, but I think we recognise that the public services across the UK at the moment are incredibly stretched, whether it's in education or health or prison services or the police or beyond. And I think whilst there's a strong case to say that the NHS and others would benefit from further investment, I also think there's a recognition that further investment is only available when we've got a stronger economy, and at the moment the economy continues to be fairly problematic. My job is to make sure that the £1.5 billion a year we receive, we spend effectively, and I believe that we do. My job is to make sure that we spend as much of it as possible directly on patient care, and I believe that we do. And my job is to make sure that we are as productive as possible, so we are reducing waste, we're maximising the assets that we have, and again, I believe that we do, and we've made a lot of progress over the last year.
Excellent. And about selling off any land?
Oh yes, no,
there's no plans.
Unless you're about to tell me something, no plans that I'm aware of.
Okay, you also were promised, and I think this has been talked about for the last almost 7 or 8 years, that £450 million were coming into being invested into Leicester hospitals. Has that arrived yet, and have we got a plan of, because there's a new maternity unit being built, there are lots of other plans. How far are we on that track?
Unfortunately, like the wider new hospital programmes, there have been delays, and I think we have to be realistic that we're now in a year of a general election, and therefore there's going to be further delays. We don't have the money in the bank, but what we do have is a strong commitment from government, and it's a commitment that would span beyond the current government to whichever party may well be in power towards the end of the year, for a significant increase in the money. You're right in the assertion that there was circa 450. It's more like £800 million now. The plans that we have previously discussed, the big key strategic elements to it, are still exactly what we're going to be doing. So just to remind people, that is building a standalone women's hospital at the Leicester Royal Infirmary. It is bringing maternity services from the Royal and the General together at the Royal Infirmary. It is strengthening intensive care provision at the Glenfield and at the Royal, and as we saw from someone who contacted us earlier, quite how important intensive care is, and it's taking further steps to separate planned care and emergency services, and we'll be doing those. What we have been doing, despite the delays, is we've been continuing to do building work. So whichever site you go on, you'll see cranes, and unfortunately you'll see disruption, and I'm sorry for that. But we have new wards going into the Glenfield Hospital this year. It was a fantastic Saturday. A couple of Saturdays ago, we opened the new robotic surgery theatre at the Royal Infirmary that was very kindly sponsored by the Samworth Foundation. And in November this year, what people may remember as the old Brandon unit at the Leicester General is opening up as a new £50 million East Midlands planned care centre where 100,000 people will be treated. So the money is coming, but there have been delays. We will be transforming our services. It will be complete by 2030, and in the interim, we'll be doing a huge amount of work.
That's really reassuring to know, and let's hope that we get all our money. And if you're listening to Radio Ramadan on 87.7 FM. I'm your host, Zuffar Haq. We're here with Richard Mitchell, the Chief Exec of Leicester Hospitals. The studio number is 0116 4822 086, or you can send us a WhatsApp message on 077 488 55055. And we've got a message coming in, and I'm just going to read it out. Somebody's sent me a message on my phone. Zuffar, I would like to take this opportunity to thank Ward 23, Vascular Ward at the Glenfield, for the support and kindness shown during my dad's stay at Glenfield Hospital. They were like a family. I couldn't have asked for more. My father passed away last Saturday, but the 3 weeks my father spent in that ward was very homely, and my sincere appreciation to every doctor, nurse and staff in that ward. Thank you.
Thank you for the message. Obviously, my thoughts are with you and your family at this very sad time. I'm very sorry to hear about your loss. Thank you for taking the opportunity to recognise the vascular team on Ward 23, I think it was?
Yeah, Ward 23.
23. Again, I will make sure that I pass on the your gratitude to them. They're yet another fantastic team that we're very fortunate to choose to work at UHL.
So, another sort of theme that's always been running over the last few months is lots of people. I was away on holiday, and people were ringing me while I was on holiday. Ambulance waits, and people sitting at home waiting for an ambulance. They're dialing 999. They get through to the ambulance services. It will be 5 hours or 4 hours. We haven't got an ambulance available. And then when they get to the hospital, they're waiting inside the ambulance before they get out into the A&E department. And then there's a wait from the A&E department onto a ward. What's actually happening, and what can people do, and what is the solution to this problem?
Yeah, it's been a problem for the NHS for a while. It's been a problem at UHL, in particular the Royal Infirmary site, for a very long time now. Since December 2022, we have made some significant and sustained progress at UHL. So for a range of reasons, before December 22, ambulance handovers at the Royal were amongst the worst in the NHS. Between December 22 and October 2023, we made significant progress to the extent where we would go for weeks without any meaningful delays with ambulances, a meaningful delay being longer than 15 minutes. And we managed to improve that by opening up some additional capacity, working on some of the internal workings between the Royal Infirmary, A&E, and the wards, but also opening up a co-located ambulance bay next to the Royal Infirmary site, where at peak pressures we could safely offload patients from an ambulance into an area that was warm and clinically led. Things became problematic from October through to about March this year, and that was because we saw a dramatic and sustained rise in the volumes of patients accessing urgent emergency care. So last winter 22 was busy. Winter 23, we cared for 9% more patients than previously. So demand just went through the roof, and despite the progress we're making, we remain quite fragile, and we cannot absorb that level of change over a short period of time. So we are working very closely with the ambulance service. We continue to work closely with general practice, with the local authorities, both across the city, county and Rutland, working with care homes, working with carers, and working with Leicestershire Partnership Trust around the many discharge pathways that exist going out of an organisation. I recognise that we've got huge work to do, and I'm personally, I think, relentless in the approach that my team and I have, trying to promote what I would call radical reform. I desperately want to work in partnership with people to provide the best possible urgent emergency care services for the people of Leicester. I recognise at the moment we are not consistently doing that.
Access seems to be a big issue, and lots of people say GP access they end up going to the A&E department as a default position. How much more are you pushing your colleagues to do more in primary care and some of the GP practices? Not all of them. I mean, we had some GPs on earlier on in the week, and they've got some really innovative ideas in how to deal with their sort of waiting times on the telephones and making sure that they're seeing people. Does that seem to be happening across the ward, or is that there's blips in that?
Yeah, so I've got huge respect for general practice. It is at least as busy as hospitals are, and as we know, general practice hasn't received the funding increases that hospitals have. So their position is problematic. We have at UHL, we have a GP, Dr. Aruna Garcia, on our trust board. We have 3 GPs in our senior leadership team. We have Abbas Tajani, we have Unati, and we have Asma. So we work very closely with general practice on a monthly basis. I meet with Grant Faheen and Charlotte, who represent the local medical committee, who are the voices of general practice. I think the relationship between general practice and UHL has improved dramatically. Like hospitals, there will be pockets of excellence in general practice, and there'll be areas under huge pressure where progress is more challenged. We need to continue working as closely with general practice as possible, whether it is general practice or pharmacies or urgent treatment centres or the Royal Infirmary, A&E, or wherever. We need to work together to make sure that patients are accessing care in the most appropriate setting for them.
We've got another message coming in. Good morning. Can I pass my sincere thanks to LRI, who cared and supported me when my newborn was taken for an emergency procedure that was life-threatening. As a new mum, it was the most difficult time. However, the staff were incredible. Thank you is an understatement. Well,
thank you for that message, and I hope that you and your newborn child are doing well. My children have been born at UHL. They were born when I wasn't the chief executive here. I have friends and family who have had children here, and it was only on Tuesday that I visited the maternity services early in the morning at the Leicester General, and then we went to the Royal in the afternoon and visited them there. I am incredibly proud of the maternity services we provide here. They are safe, they are high quality. I know that we had the Care Quality Commission, the CQC, came in and rated them last year. The CQC have been back in early this year in February, and we are patiently waiting for the report. The initial findings are positive. They've identified that we have more midwives working than previously, that we've taken steps over at the General to separate planned and emergency C-sections. We've got work to do, but the maternity services in the city of Leicester are safe.
And you know, lots of staff you've got across the hospitals, they do an incredible job, you know, and we keep hearing that. but they are tired, and there is a retention issue, recruitment of staff and retaining them, and that is a pressure that you have, isn't it?
Yeah. So retention is better than it was. We've actually seen I'll touch on the reasons why in a moment, but we have seen a reduction in the number of people leaving UHL. Obviously, we would always support people with their career choices, but I would hope that UHL can continue to be an employer where the best possible people want to join and stay with us. We have seen a huge rise in the volume of people we employ. So as I said, it's now 19,000 people. 3 years ago, it was more like 15 or 16,000 people. I recognise, as I said, the experience of working in the organisation is variable, but to be the fourth most improved from a staff survey perspective across all ethnicities, all professionalisms, is a huge undertaking. What we are, and again we're discussing it in our public board on Thursday, where we are focusing on to improve the experience of working at UHL for all. The four things we're focusing on are recognition, inclusion, support, and equipping people. So recognition, as 2 or 3 people now have picked up on, when people do a good job, whether it's an individual or team, we want to find meaningful ways to recognise their efforts. We have fantastic annual awards, and I would always urge people to put names forwards for that. Last year, we started Long Service Awards, and we celebrated the long service of over 3,500 people at UHL. We had some fantastic afternoon teas in the Leicester College and then also in the Secret Garden. In terms of inclusion, what we are doing is working with our networks that recognise different characteristics of people to make sure that diversity across the organisation is celebrated, making sure that people feel that they've got a voice, that when they speak up they will be listened to, that it is safe to raise concerns. We've been doing a huge amount of work around support, and a big piece of work over the next 12 months will be strengthening the competency and the capability of our middle tier managers in the organisation. They've got some of the most difficult jobs because they have people, well-meaning people like me, who tend to interfere in their jobs, and then they have lots of other people that they're trying to support as well. So we want to be a more supportive organisation. Then the final bit is around equipping, whether that is Wi-Fi or on-call rooms or car parking or hydration or food or a range of other things. We have spent a lot of money over the last year on improving the availability of equipment within the organisation. We've got a huge amount more to do.
It sounds like you've done lots of things, really comprehensive sort of challenge that you have, and you're really looking across the board to see what you can do and really making a difference. It is transpiring though, isn't it? Because you do feel that the messages that we've got coming in, there will be some ones that won't be so good, but at the moment we're getting quite a lot of positive feedback from lots of patients. Once they're in there, the service is very good.
Yeah, so as I think, and I've touched on it before, I think everything in life, it's important to strike a balance. So I joined UHL, as I said, in October, November 21, and it's been a really difficult 2.5 years. What I have tried to do with the support of people is to change things. I've tried to stabilise the organisation. I've tried to move us into a recovery phase, and now we're trying to deliver radical reform. I'm not sat here saying I'm going to give the organisation 10 out of 10 for its culture or 10 out of 10 for patient care, because that's not where we are. If you think of a scale from 0 to 10, I think we are moving in the right direction. But I think the potential of University Hospitals of Leicester working with the University Hospitals of Northamptonshire is vast. We've spoken understandably quite a bit today around our service provision, and the services we provide are safer, more accessible, providing more timely care than they were 12 months ago. We've spoken quite a bit understandably around the culture, and that undoubtedly is moving in the right direction and underpins everything that we're doing. We've touched on the money. Our financial governance against an incredibly challenged position is better than it was. From a strategic perspective, we've got some key themes. We launched our new strategy last year. We've got some key themes in there. And the two things that I've sort of alluded to but haven't really focused on, but I briefly will, is what we would call partnerships for impact. The partnerships that we have, whether they are with people such as Ramadan FM, or whether it's with the voluntary sector, community sector, other NHS or local authorities, are incredibly important to us. I had a fascinating conversation yesterday with Rob Nixon, who heads up the police force in Leicestershire, about the work that our organisations are doing together and will be doing to make Leicester City the best possible place it can be to work and to live. And then at UHL, we provide world-class research and world-class education. We're very proud to be the host of the Leicester Biomedical Research Centre. We work with the University of Leicester and Loughborough on that. The BRC, the Biomedical Research Centre, is one of the best in the UK, and in particular the research that comes out of the Glenfield is world class.
One of the things I've noticed over the last few weeks doing these shows, Richard, is the talent that you have at Leicester's hospitals is second to none. So many world-class leading consultants are working here rather than anywhere else.
Yeah.
They've not driven to London. But we had the world's leading people on diabetes, on smoking, on shisha, on lots of different areas, and I just think, wow, we've got a fantastic team looking after our population in Leicester and Leicestershire. Yeah,
and it's actually beyond that. Inevitably we think about the professors and the consultants and the senior medics, but you look at the midwives, the nurses, the allied health professionals, the non-clinical colleagues. Is it bias? Is it pride? But I think the people we've got working at UHL are amongst the best in the NHS and across the world. Across the world. Yeah. Someone who I think you had, I know you're going to come in, but someone I think you had on your show, on one of these shows earlier in the week, Sanjay Agarwal.
Yeah.
World leading in smoking cessation. Yeah. And there's he has just written a fantastic report on behalf of the Prime Minister's unit about the importance of not smoking and now not using vapes.
Yeah. Excellent. Sorry, we're running out of time, but I'm going to get this in. Salam, it's Zuffar, and I want to thank the hospitals for its efforts and all the amazing people who are doing a wonderful job, and I would like to donate £3,000 to the hospital charity. Thank you, Zuffar.
Oh, Zuffar, that's amazing, an incredibly generous donation. So thank you so much for that. If appropriate and you'd be interested, it'd be lovely to catch up face to face to thank you personally for that, and we can work with you to make sure that very generous donation is spent effectively.
We're running out of time on Radio Ramadan. Firstly, thank you very, very much, Richard, for coming in, and thanks to all the teams and all the support staff that work at our hospitals, doing a fantastic job under very difficult circumstances on occasions, and it gives an opportunity to say Eid Mubarak to everybody, and if you want to quickly wish Eid Mubarak to everybody, you can do.
Eid Mubarak to everyone. I'd like to wish everyone a blessed Ramadan. It's always an absolute delight coming on this radio station. I think it's possibly the fourth time I think I've been on, certainly the third time. And may I conclude with thanking you, Zuffar. You're always very generous in your recognition, incredibly humble person. Thank you for everything that you do.